Hello, I'm Don Berwick. I'm President Emeritus and Senior Fellow at the Institute for Healthcare Improvement in Cambridge, Massachusetts. And I also have the great privilege of having served as a member and advisor to the Bevan Commission for, many years now. That has allowed me to get to know a bit more about Wales and a lot more about Wales' potential to develop a healthcare system that actually is world-leading in its approach to providing health and well-being to the population in Wales. The setup in Wales is terrifically favorable. It's a country of the right size, with deep investments in communitarian approaches to well-being, a real sense of community there, and entrepreneurship, a sense that redesign and innovation can always lead to better results in healthcare or in any other domain. Now, I wish I could be with you in person to discuss Prudent Healthcare and the potential I see in Wales, and I appreciate the chance to join you this way. I see the Prudent Healthcare framework as an extraordinarily important intellectual achievement, not just for Wales, but for those of us around the world who think about making health and healthcare better. I want to explain why and what I see as the real promise of Prudent Healthcare as a framework. Those of us interested in quality, which is my career-long endeavor, know that the performance of a system, any system, including a healthcare system, is intimately bonded to its design. Design and redesign are the routes to improvement in any enterprise. So it is in healthcare. Now, what we know about our healthcare systems is that worldwide, in Wales and everywhere else, they are not performing at the level that they could. They don't achieve the aims that society actually has for healthcare. That's not because of any defect in the motivation or intention of the healthcare workforce. It's not a matter of failures of will. It's a matter of failures of design. Healthcare around the world, historically, has been designed in a way that stacks the cards against success. By success here, I mean the IHI triple aim, the Institute for Healthcare Improvement's approach to setting aims for healthcare systems. The triple aim is the simultaneous achievement of better health care for individuals when they need care, better health for populations, so people need less care, and lower per capita costs, so healthcare is not absorbing more than its fair share of public and private opportunity. Better care, better health, lower cost. Prudent healthcare, to me, is an effort to write down in a very efficient and very compelling way a set of design principles that then allow us to reconfigure care to achieve the triple aim. Let's go through the Prudent Healthcare principles very quickly to make the point. First, achieve health and well-being with the public, patients, and professionals as equal partners through co-production. That concept of co-production is not just a word, it's a basic fundamental design idea. That unlike a product like a computer or a television, healthcare is not something delivered to a recipient patient. It is something co-created by the patient, family, and the community, and the experts that attempt to help the patient, family, and community. If we can really reorganize healthcare around the idea that the care and pursuit of well-being is always co-produced, always done jointly by the beneficiary and the person attempting to help, we would end up with a healthcare system with a completely new balance of contributions of knowledge, leadership activities, ownership of care processes. It's extremely exciting. And around the world, when I watch organizations move more toward that balanced idea that we, patient, family, community, and professionals are together going to invent health, to create thriving, I see exciting new ideas about how that can go. The modern world of telemedicine and telehealth and the web and the computer world opens up entirely new boundaries, new ways for us to use knowledge together to achieve health and well-being. The second principle is a moral principle in Prudent Healthcare: care for those with the greatest health need first, making the most effective use of all skills and resources. Help those first who most need the help. That is a fundamental design idea in healthcare. It would configure resource investments. It would configure the use of capital, the competence building of both the public and professionals around the idea that there are vulnerable people in our societies, and they are where our duty begins. And it says making the most effective use of all skills and resources. That means healthcare that embraces community-based resources, the energies of entire populations to help meet the needs of the most vulnerable first and everyone thereafter. It widens the concept of healthcare itself way outside the boundaries of the institutions and professions and disciplines that we've built. The third principle, do only what is needed, no more, no less, and do no harm. There's a lot in that. Do only what is needed means beginning to ask very hard questions in healthcare about what really helps and what does not help. Because in the healthcare of the legacy system, we've gotten trapped like a gerbil on a gerbil cage, running and running and running, doing more and more things without pausing and asking, is this use of resources, is this use of time, is it actually help or is it waste? And a sophisticated inquiry and a sophisticated and trusting dialogue between the public and the professions around what really does help and what really does not could lead to healthcare far more sustainable, far less wasteful of the talents and energies of patients, families, communities, and providers. And if we focus on patient safety, do no harm, we will be following in a trail blazed, by the way, in Wales with the 1,000 Lives campaign, in which we begin to center the safety of care, the avoidance of injuries through errors and miscalculations with patients as at the center of our strategy. Wales has a chance of being the safest healthcare country, the safest country in the world with respect to the healthcare it produces, if and only if it embraces the design principle that safety comes first. And finally, reduce inappropriate variation using evidence-based practices consistently and transparently. My father might not have liked that. As a doctor trained in the doctor knows best era of design, the idea of standardization or coming together around evidence would have been a little threatening. He might have felt his hands a bit tied. Today, the amount of information that pours out of the scientific community every day, the number of randomized trials and the progress we're making in science no longer is accessible to the single unaided human mind. We're going to have to agree as a design principle for the care we want that it will be reliable. It will adhere to the best known practices from science throughout the world. It doesn't mean handcuffs. It doesn't mean that physicians and surgeons and nurses and pharmacists and therapists stop using their brains. Of course not. We have to preserve adjustment at the sharp end of care, exactly where the patient meets the care, so that smart people can do the right thing, even when it sometimes violates the rules. But the basic design principle of reducing inappropriate variation, random variation that's not cognizant of the underlying science, that's not a value we should adhere to. We need to begin to realize that healthcare at its best is a scientific endeavor informed by science, and that it's not the loss of professional autonomy, it's the gaining of professional reliability. And it says evidence-based practices consistently and transparently. Transparency is another very important design rule for the healthcare of the future. It allows us to learn from each other, to know what really is best, to be able to find out that hospital A is doing better than hospital B, and we need to understand how they're doing that, not for blame, not for exhortation, not even for incentive, but for joint and mutual learning. Underlying the Prudent Healthcare principles to me is the vision of healthcare in Wales as a learning enterprise, Wales as a learning nation. That's exciting. These four principles, Prudent Healthcare, I think are among the richest combined frameworks I've ever seen in the attempt to define healthcare capable of achieving the triple aim. So my plea for Wales is get about the job. Better care, better health, and lower cost, not through the historic system, through the new system. And if you want to find design principles on which to build that new structure, that new house, that new home for thriving, check out Prudent Healthcare. You'd hardly be able to find anything better. Congratulations on the work so far. I've been delighted to get to work with Wales through many years of my career, and I look forward to many more years of colleagueship with you and your amazing country. Thank you very much.